Hey, so why should we give up our civil rights for a virus? I've been struck by several of my friends on social media, and actually the maitre d' at the cafe I went to for lunch today, who were very strong in expressing the opinion that this was an opportunity for the government to control us, that this was all pretty well made up for the government to borrow money from the banks. There's all these intricate conspiracy theories put out there by people as to what this is really all about, this pandemic. But the thing is, the difference between this pandemic and previous pandemics, which killed millions and upon millions of people, bubonic plague, the 1918 influenza virus, and that in fact killed more people because of their living in squalid conditions very close together after the First World War. And they actually died of secondary bacterial pneumonia, not the influenza virus itself. So COVID is different. It's happening now. It's happening in 2020. It's happening. And the thing is, the difference is science. We know how to battle this particular virus as best as we can because science has figured out over the century, and partly as a result of the information from the Spanish flu, that social distancing was the key to cutting down transmission. So quarantining and separating people was a very important, a very important way to control the virus. So the question is, do you want to control the virus or do you not? Now, in this particular case, people are deciding both ways. There are the countries where they have the inability to control the virus. There are the countries where the leaders are inclined to keep the economy going at all costs and bugger how many people die. And so you can see the consequences of all of these different choices. And there's the countries that can follow the science and are locking down appropriately and quarantining and contact tracing and all of that sort of stuff. So whatever choice you make, you see the consequences. Where they've opened it up, say in Sweden and Brazil, America, USA that is, absolutely opposed to Canada, which is much more along Australia's model and New Zealand's model. You see a virus that's getting in and infecting very quickly quite big swathes of the population once you let people gather together and open up the economy, open up the contacts. So this is just a choice of government, how they handle things. This is not a conspiracy theory. Everybody wants the economies to keep going. And the question is how you do that the most successfully. If you choose not to lock down or quarantine people away from each other when they've got the virus, it spreads incredibly quickly and it's going to kill about 1% of people who get it, and a higher percentage, maybe up to 10% of people that are older. So you're making that choice. If you let that virus get into that particular population, you run the risk of a huge number of people, if you really let it run right, surging into the hospitals, into the intensive care departments, overwhelming intensive care departments, and getting old mugs like me, who should be doing simple operations, actually looking after intensive care wards full of COVID patients, and putting me at very high risk of getting COVID, and all the nurses looking after them and everybody else. So people are making these choices, and governments are acting either on the medical advice or on their gut feeling that they'll just let it run rampant. You let it run rampant, the trouble is, even in America, it's probably only penetrated about 7% of the population. So it is not about to, even less, it's not about to die down. It's going to keep getting bigger and bigger and bigger, and more people are going to die, and more people are going to be in hospital and have the consequences of the virus without a chance to get a vaccine. Now, put aside all your conspiracy theories about vaccines. A vaccine will hopefully be educated to realize that they're only going to pick the safest vaccine to distribute. Yes, somebody's going to make some money out of that. Big whoop. It's to protect society. It's to protect and cut this virus out and to give us herd immunity. That's what a vaccine does, is gives the community herd immunity. If you go herd immunity through the virus itself, potentially millions and millions of people are going to die. Already over 600,000 people have died of this. These are real people. This is a very virulent disease. It's raced up through the ranks of things that kill people in society to be about number 2 now behind diabetes. It's gone past suicide. It's gone past a lot of really well-known causes of death, way above influenza in 2020. So, these are choices. This is not about conspiracies. It's not about governments doing stupid things, unless, I think the stupid choice is to let it run rampant. That is nuts, because so many people get to die. The vaccine comes along and cuts it out, hopefully, but it may not come along in January. It might be 2 years before we get a vaccine. So I don't know. I just think people need to be educated so much better. I hope this goes a little way to educating people, because I'm so surprised that people I love are saying ridiculous conspiracy theories about this. This is not an opportunity for the government to take control. This is a true health crisis.